There we go. So conversion therapy refers to organized efforts to avoid expressions of lesbian, gay, bisexual, and queer identities and gender identities that differ from sex assigned at birth. But this term is misleading. These efforts attempt to suppress or deny LGBTQ identities, but they cannot convert or change intrinsic sexual orientation or gender. And these practices are certainly not therapeutic. We know from various studies that as many as 1/3 of those who've undergone conversion therapy have attempted suicide. And from multiple Canadian surveys, we estimate that 1 in 10 LGBTQ2 people have directly experienced it. And yet, public knowledge of contemporary conversion therapy in Canada is limited. Popular representations come from films like But I'm a Cheerleader, Boy Erased, and The Miseducation of Cameron Post, all of which were set in the United States 15 to 30 years ago. At the moment, the federal government is considering a bill, Bill C6, which, if passed, would make it a crime to practice conversion therapy targeting minors. This is good news. It shows that the federal government and others are beginning to see the harm of these practices. And when my research team at SFU saw that the bill was coming, we mobilized interviews and a survey to try to generate data, current rigorous data, to understand the scope and nature of conversion therapy in Canada. We heard from 110 people from across Canada, including 74 with direct experience. Half of the participants indicated that the definition of conversion therapy in Bill C6 did not fully encompass their experience. And I've included 2 quotes to help explain this gap between the bill and the reality of conversion therapy in Canada. One said, "This definition explicitly excludes my experience with conversion therapy as it occurred as part of trans healthcare programs." And another said, "Most conversion therapy that I went through wasn't super formal. It's prayer groups and exorcisms and other practices. It's often masked as a pursuit for purity or godliness. It's not necessarily about getting rid of the gay, but becoming more godly, which is hard to make illegal." So in these cases, the conversion therapy practitioners had resisted the label of conversion therapy, hiding behind their institutions, whether religious or healthcare. What we've learned is that the forms of conversion therapy that are conveyed in the films in the top right are really only the tip of the iceberg. I want to point out that trans reparative therapy practices, which are entrenched practices that deny access to life-saving, gender-affirming healthcare, are also conversion therapy, insofar as they work in an organized fashion to deny trans identities, just as the ones described in these films on the right deny gay and lesbian identities. Unlike the conversion therapy camps and programs represented in these films, trans conversion therapy are often embedded within our healthcare system. And conversion therapy practices are held up by an even more prevalent set of practices called SOGIs, or sexual orientation and gender identity and expression change efforts. Whereas conversion therapy are structured, SOGIs are less clearly delineated, and these include conversations, educational messages, efforts that will cast doubt on the validity of being LGBTQ. Take, for example, a brochure that instructs parents to talk to their kids to make sure that their kids know that, quote unquote, people don't change from one gender to another as they grow. Who they are as a gendered being today is who they will be for the rest of their life. In one interview, we learned about a mobile phone app that supports men who are struggling with so-called sexual addictions, including unwanted same-sex attraction. And at the bottom of the pyramid are the widespread societal belief systems that continue to privilege cisgender and heterosexual people. And in our view, these 3 components of the pyramid are inextricably related. And this is why a criminal ban is not enough. In December, I had a chance to testify before the Standing Committee on Justice, outlining what we had learned from this research and outlining the ways in which Bill C6 was too narrow to capture many ongoing conversion therapy practices, not to mention SOGIs. And this is what I told them. The defining feature of conversion therapy is not an attempt to convert or change intrinsic feelings of gender identity or expression or sexual orientation. Rather, the defining feature is the goal of avoiding acceptance and acknowledgement of LGBTQ2 lives as compatible with being healthy and happy. And this healthy sense of self is something that all Canadians deserve, regardless of sexual orientation, gender identity, or expression. And that sense of self is really what's fundamentally at stake in the debates over conversion therapy. Happy to answer questions at my booth after, and thank you for your time.